name is Harrison Auerbach, and today we have Dr. David Auerbach, who is one of the owners of Eye Physicians of Central Florida, which is an ophthalmology clinic based out of Maitland, Florida. Thank you for sitting down with us today, Dr. Auerbach.
My pleasure.
So I'd like to just start off, tell me a little bit about the business.
It's an ophthalmology office, so we deal with medical and surgical problems of the eyes of all ages, from birth into your 90s. We take care of all problems that can possibly happen with the eye.
Okay, that sounds great. What made you, decide to open up a business like this?
Well, when I got out of training, there were only two options. I either had to work for someone or open up my own practice. And I actually did work for someone for about 18 months, and it was really not a good fit. And I felt it would be in my best interest to start a practice.
Did you have any signs from the beginning that you felt like you didn't want to work for someone, that you wanted to be an entrepreneur and go off on your own?
That's a good question. I did not. When I was training, when you become a doctor, it's not a normal business route. And when I was training, you always think you're going to hang your own shingle and open up your own practice. So that's what I thought was going to happen. But when I came out, it's a different story, and I had a couple of job offers to be an employee, and I figured that was something that was guaranteed and less risky. And you have to take some risk, and I felt that after spending 18 months working for someone, I did not think that was a good fit for me.
From the beginning, did you want to be in the medical field, or were there other options?
Yeah, I pretty much always knew I wanted to be a doctor.
Okay.
I wasn't sure I was going to be an eye doctor, but I always wanted to get into medicine.
So Maitland, Florida here is a pretty nice area. How did you go about finding the location for this business?
Well, I started out when I was working with someone else that was in South Florida, and I was looking at different demographics of patient population in different cities in Florida, and I also looked to see how many eye doctors were in those areas, and when I looked at one versus the other, Orlando, Central Florida looked like it was a growing area and was not saturated with eye doctors.
Aside from working from someone else down in South Florida, like you mentioned, how does it differ, this area, having an eye doctor location, in Central Florida rather than South Florida?
I don't know that there's much of a difference. This practice is different than the practice I was in when I first started. The practice was an adult practice, all adults, when I first started. In this practice, it's 50% pediatrics and 50% adults. I don't do any pediatrics.
So you have other partners that just deal with children then?
Yes, there are 10 doctors that work in the practice and 4 owners. The other doctors are employees.
Do you guys own the building and just the business together equally, or is it split different ways between the 4 of you?
No, we all own equal shares of the corporation.
Okay. I know that marketing in any business is a very important aspect of the business, to get your name and your face out there, if that's what it is. So how, what, and when did you advertise to promote a business like this?
Well, we advertise in some of the local periodicals in Central Florida.
By periodical, is that a magazine?
Magazine.
Okay.
We don't do a lot of newspaper, we don't do any radio, we don't do any TV. Most of the doctors that work in this practice are subspecialists, so our practice is mostly driven by referrals from other doctors. So we try and do our marketing. We do actually have an outside salesperson who, prior to working for us, worked in the pharmaceutical industry. So she knew how to go into doctors' offices and, ask them what they needed, if we were doing everything that made them want to refer to us. So she goes to their offices, and we're mostly driven by referring doctors, other eye doctors. That's how we do most of our marketing.
Okay, that's cool, because it seems like you don't need to do a lot of, spend a lot of money advertising on billboards or things like that if referrals is most of the way you get your business.
Right. We don't have to spend money like that, but we do have an extra employee with her salary and all of her benefits.
Okay, that makes sense. I was just about to ask about employees. I understand that attaining, the right number and the right type of employee is extremely hard in any business, and it takes a good set of employees to, grow a business to something great. So how do you find potential employees that that you'll trust, and it seems like a very hard thing to do?
It's the hardest part of this practice, and I would imagine we'll call it human resources. Trying to find candidates in this field is very difficult. There are a lot of different positions that need to be filled. Checking patients in, checking patients out, people who have zero patient care, checking people's benefits and eligibility, and then there are the clinical staff that do work with patients. We have about 60 employees, and sometimes it is difficult, or I should say oftentimes it is difficult to keep people. And you know, in the way the economy is, the way we keep them is through salary and benefits and giving them a nice, safe, enjoyable work environment. And then there are times where the person that we hire for the position that we hired them for, excuse me, they're really a great employee, but they're just not in the right position. There was a book, Good to Great, where it said, imagine you're thinking that you're on a bus and you have all the right people on the bus, but some of those people might not be in the right seat. So we know that we have the right people, but every now and then somebody's got to change seats. And we have found that to be the hardest part about running the practice. You would think it was the medicine, it's really human resources.
Okay. So what would you say is the most important quality of an employee at this business?
The most important quality, well, they have to like working with people.
Okay.
Because even if you're behind the scenes and not having anything to do with patient care, you're on the phone with people, you have 60 other people that you're working with, so you have to be able to work as part of a team. If you're the type of person that just wants to be by themselves, this is not the right place for you.
Okay, so it's a lot of customer service that your employees are dealing with.
Absolutely.
Okay. How long does it approximately, I know every position is different, but how long does it take to train a newly hired employee? You know, I know it'll be different for someone who's doing the, you know, signing patients in and out rather than dealing, you know, directly with you and with the patients, but on average, or maybe you could give me a position and how long about it takes to train an employee?
Okay, so let's say we'll start at the top. Well, not really the office manager, but somebody who works by my side, an ophthalmic technician. It takes about a good month to train them, and there is, prior to the advent and our usage of electronic medical records, the training was a lot easier. They just had to really know the medicine. But now, with all the government regulations of electronic medical records, it's very difficult to find someone who, one, knows the medicine and is also computer literate and can deal with the electronic records. So it takes about a month, and when a person like that, when there's turnover, it is very costly to the business.
Okay. And you know, it seems like you and your partners have built this place up very well, and your business seems like it's doing very great. But personally, what makes you feel like your business is successful? Like, why do you feel like you've been successful in, you know, running this operation?
Okay. Well, I go home every day knowing that I've given 60 people a job, and they can provide for their family, and I can provide for my family. I enjoy I get up every day and I enjoy going to work. I know I'm helping people, practicing medicine, doing surgery twice a week, and the people enjoy working here.
Oh, that's a great answer. And this interview has been extremely informative. I just wanted to thank you so much for your time. I very much appreciate it, Dr. Arbach. Have a great day.
My pleasure. Good
Thank
luck.
you.